Welcome back, folks, to our Thrive and Aligned Healing podcast. This is episode 147, and today we're going to talk about you don't have to lose weight to get medical help. So this is coming up a lot in my practice, and so I felt like it was something that we needed to talk about. Now, if you haven't had this experience, I am very excited for you, and I'm thankful that you haven't had this experience. And for those who have had this experience, know that you always have options. Okay. So in my practice, just within the last maybe 3 weeks, it's kind of has come up again, where folks have in the past reached out to doctors or primary care physicians for support on any symptom, XYZ. One person, it is asthma and chronic bronchitis. For another person, it's hormones. She's having problems with hormones and having 2 periods a month, having bleeding for 10, 14 days at a time. And then for the third person, it's actually a lot of swelling and bruising that's happening in her lower extremities. So these are all symptoms that at first look, these are all symptoms that aren't necessarily compounded or exacerbated by weight. But when they went to their primary care physician and asked for support, they told them that they needed to lose weight, and that was what was going to fix their swelling and their bruising in their legs. That was what was going to fix their bronchitis and asthma, and that was what was going to fix their prolonged periods and their anemia, right? So when they have this experience, right, it's very disheartening that the medical professional in front of them won't address their concerns in front of them, and instead they're wanting to address this person as somebody who everything would be better if they just lost weight, right? Which hopefully our listeners know by now that is not the magic situation, right? Bodies come in all shapes and sizes, but you have folks who don't have a weight problem, who have asthma, who don't have a weight problem, who have hormone, and out of balance periods. And you have people who potentially, have, bruising and swelling can be caused by different things, but who, may have a blood disorder or may have blood clots or something, and it's not a weight problem, right? And so it's really disheartening to me when folks are, it's not even cautious, but don't seek help because they already in the back of their mind know, right? Oh, that this medical professional is going to tell me that they can't help me until I lose weight. Right? And then it puts them in this cycle, right? Of like, they're already worried about their health. They're already, trying to combat their acute symptoms or the symptoms they're experiencing now. And now compounded on it, right in the back of their mind, they're like, oh gosh, now I have to lose 20, 30 pounds before I can even come back. And then maybe then they will, see me and check out my lungs or run an x-ray or do something of that nature, right? So it really puts people in a challenging position because if they're not addressing those symptoms, right, there's the potential that things are getting worse, that things are compounding. And then there's the aspect that people may try to lose weight so they can get back into that practitioner so that, hopefully that they will address their concerns. And then they're doing crash diets, right? Like they're starving themselves. They're, they're not making lifestyle changes. They're not making healthy choices in order to sustain a healthier body, right? They're thinking, oh, I've got to move that scale. This body has to look different in order for somebody to take me seriously and address my concerns. Right? And I think that's a little bit of a challenge, and I think that the medical field can do better. Yeah, because folks, I want to encourage you, right? Like there are thousands of doctors out there. All doctors are different, right? Even amongst naturopathic doctors, right? There are a lot of naturopathic doctors that practice naturopathic medicine very differently. So even if you're in a small town, in a small area, I am going to encourage you to fire doctors until you find one that will listen to you, right? With where you're at, right? Somebody who will work with you and support you on your journey to better health, right? If you work with somebody who not only addresses your acute symptoms, help get you feeling better, like, oh, you can't exercise because you have asthma? Well, let's address that first, right? Instead of, starting this negative spiral to worsen our health in hopes of trying to get extra support.
Yeah. I guess maybe it's like sometimes I can see the millennial in me coming out. So maybe it's the millennial in me. Like I've always been intrigued because the generation before, like I was raised by baby boomers, and it was like the doctor's the expert.
Mm-hmm.
They are at the top of the expert ladder in society and they know all. And you just do what your doctor told you to do, right? And then I think my millennial brain, like anytime I pay someone money, I'm like, I am the customer and I am always right. And if I don't like what you have to tell me because I'm paying you, I'll go pay someone else. And
Yeah.
so, I mean, yes, I know that's entitled, whatever, but it served me because I don't look at doctors in this way of like, you're the expert. I'm just like powerless and I have to do what you tell me to do. Like, no, if you don't give me the answers I'm looking for, I'm going to go pay somebody else. Like, I'm paying you. I expect to get the level of service that I expect from anybody other business that I'm paying.
Yeah. Yeah. There is a generational change. Yes, I will definitely give you that. Um, I had I was visiting with somebody the other day and she was talking to her father. She's in her 60s, her dad is in his 80s, and she's very naturopathic, medicine minded. And she wants to know the science. She wants to know, like how things work. And so she was talking to her dad, who's in his 80s, and telling her dad about her experience at the doctor's office and that the doctor couldn't answer her questions. And her dad said to her, out of like disbelief and disdain of like, I can't believe you questioned the doctor like that. And I was like, oh, yes, this is a generational difference. But here's the thing, there are even doctors who are older in their, and it depends on where you are, but there are doctors who are in their 60s and 70s who grew up with a patient, or not grew up, but grew up in practice
Yeah.
um, with patients like relying on their every word, right? And they they continue to have that attitude, right? And then there are some who've been around who've seen medicine change and seen the science change, who are a little bit more open and recognize, there's always more than one answer. There's very rarely just one
Mm-hmm.
answer. And so you get the whole spectrum. Yeah. So if you don't get the questions answered in a way that makes sense, seek someone else, right? Seek something else. So whether that's online, whether that's, a different practitioner. We were taught in medical school that our job was to explain things in a way that made sense to folks, right? We're taught that.
Were you taught
Now,
that in conventional medical school or in naturopathic medical school?
no, we're taught that in conventional medical school.
Okay.
But that does not translate to when you're in rotations, when you're in the field, when you're at the hospital doing rotations with your preceptors and mentors, when you're in um, residency, that does not translate because the preceptors and mentors don't do that with their patients.
Hmm.
Sometimes they don't have the time, to be honest. And sometimes it's, a difference of opinion. but everything is moving so quickly that you don't have time to explain things, right? So we were still taught that that was our job, that we were supposed to, be that advocate and be that bridge for patients to help them understand, right, and be a part of their healthcare plan in school, but that does not translate into practice in the medical world, in the medical field. So it really just kind of goes out the window when you're in rotations, when you're in residency. There isn't time, right? So you find yourself, like cutting people off and like, hoping they don't ask another question or tabling it until next time, and sometimes that next time is 3 months, 6 months away. Maybe they'll bring it up again, right? Maybe they won't, and the challenges with the use of the internet, right? So people can look up stuff online all day long. And that gets really frustrating for some folks in the medical community and for docs, because they'll be like, oh gosh, here comes a patient who's consulted Dr. Google again,
Yeah, God forbid you have an informed patient.
Exactly. It's like, okay, you know, um, people are doing their homework and trying to find answers, oftentimes, to be informed, to understand what's going on in their body. And they're coming to a medical professional for more support, right?
Yeah.
More answers, more tests, more labs, more data, a different perspective that they weren't, or they tried something online and it didn't work, right? But it's frustrating to me to hear cases when the docs really just kind of blow it because they're not listening to the questions, and it's just automatically already about something else instead of what the initial concern was.
Yeah. And like, I don't want to vilify doctors. I think part of it is the system that we have created and the medical system, but also really, I will vilify the insurance companies that have forced the medical system into this. You have these rules. If you want to get paid, you got to get these people in and out this fast. We'll only pay for this much. So I'm assuming that a lot of the doctors are just handcuffed by this.
A lot of them are, when it, especially if they're not in private practice, if they're working for or with a hospital administration or with a larger conglomerate where they're not a partner, yes, they really kind of have their hands tied. So they don't really have, a lot of time in general, but that doesn't mean they can't still answer questions, right? That doesn't mean they still can't, like take the time to listen to somebody's concern and try to help to put the pieces of the puzzle together for them. Yes, yeah. But we're fortunate in the sense that there are doctors all over the country, right? Who practice medicine, the whole spectrum, right? From 100% conventional to functional, right? To integrative, to naturopathic. Even, I mean, technically now you can find functional medicine coaches out there, holistic nutritionists, right? Like we have a lot more access to different practitioners who can shed light on a situation. And I just want to encourage people to, if you have an interaction with a medical professional and it didn't go the way that you expected, or you felt guilty, you felt shamed, you felt, belittled, it is okay to fire that practitioner and find somebody else.
I love it. Love it.
Yeah.
Cool. Anything else?
No, I hope that makes sense. Yeah.
Take your power back, people.
Yes. Yeah. Don't let them do that to you, please.
Cool. Thank you, Dr. Carmen.
Thanks.